I think you know, we'll spend the next 45 minutes or so really exploring the landscape of what's in store for us as we consider technology for older adults, promoting healthy aging, and also for your organization. So what are the opportunities and what are the challenges that we all face? So to get things going, we have two very distinguished speakers. All of us survived the Washington, D.C. traffic. Actually, that's the reason for some rearranging this morning. It's been a special.
It was my fault. I'm sorry.
Yes, it took Andy 2.5 hours to do, what, a 20-minute drive. Yes. So it took me something similar, but I came early. So anyway, Andy Carl is an award-winning professor and founding director of the program in Senior Housing Administration at George Mason University in Fairfax, Virginia. In 2014, he coined the term nanotechnology to define technologies designed, intended, or that can otherwise be used to improve quality of life for older adults. Andy has served as a consultant or advisor to numerous technology companies, including Nintendo, Apple, and GTX Corporation, with whom he helped develop the world's first GPS shoe for individuals with Alzheimer's at risk for wandering. So we may all be buying those. So. We also
47%.
We also have with us Yoon Shim Nan, who is a professor and the program director for Nursing Informatics program at the University of Maryland School of Nursing. She also serves as the co-director of the Biology and Behavior Across the Lifespan Center of Excellence at the university. Her research focuses on the use of technology-based interventions to promote and manage the health of older adults. She's conducted various studies in this field, including qualitative measurement, theory testing, and usability studies, as well as longitudinal intervention trials. And she's developed and implemented multiple online health behavior interventions for adults aged 50 and older and their caregivers. So we have some great people to help us here. Each of them could give long presentations on what they've been doing and what they can offer us. But what I'm going to ask is that you all can interweave that type of information into your answers, your questions, so we can get through as many questions and allow as many people as possible to participate. So, Dr. Nam, I'm going to start with you. So why technology, and who is it really for? Why this focus on technology now?
First, I want to say that this morning I was listening to your discussion and I have learned so much, and I made a note. And I think that you already know what is why we use technology and what is who's that for. But I just want to expand what you discussed, and I would like to have more conversation. So actually, technology, the term is originated from the Greek word science of crafts. So technology can mean processes and tools, right? But the bottom line is the technology, we use it to augment our ability to do things, or a technology, we use it to improve our lives. So the bottom line again is that the technology should help the users, and it should fit the users. I think we discussed a lot this morning is that some technology fits very well for younger generation, but the same technology doesn't fit for older generation, right? The iPhone is a good example. Some older folks still like landline phones, right? Because nowadays young folks, they do not have even a landline at home. They just use iPhone. But actually I'm in that generation too. I prefer landline because somehow I can hear better. So that's a good example from your perspective. One information system that works perfectly in one organization doesn't work for another organization because there are many other issues that are operating, human factors, policies, and procedures, right? So in that case, that technology is not for that person or organization, right? So I think that why we use technology to improve or to augment our lives, and what is the technology? Who is the technology for? It's for users. the technology is for users, so it should fit the users, then what we need to do is that for the developers, we need to develop technologies to meet users' need. And I heard some interesting thoughts this morning that the audience kind of discussed that human beings adopt technology. I think that's I heard, but I think it's got to be two-way. For example, when the developers develop technologies, they should identify user requirements. What really users need, then build the technology. And sometimes, of course, users need to adopt their behavior to improve their processes. So it's got to be two-way. But I think that's important that technology need to be developed to fit the users. At the same time, the administrators or the organizations, when they select technologies, first they need to identify what are the users' need, or what do we have right now, what is a feasible technologies, then adopt technologies. So the most up-to-date or most robust technology might not it for you, because you just need to find the optimal technologies for users and for yourself. I think that's
Thank you, that's great. And Andy, so how is and how will digital technology impact the quality of life for older adults?
Look, I think at the end of the day, it's about independence, not just for seniors, for caregivers, for healthcare providers. Colin and I, like we talk about active adults, and I call them automated adults. And I would argue it's the same thing. Our ability to communicate across lines, across generations, across boundaries, our ability to have our parents or ourselves be able to stay independent at home longer without a home health nurse having to spend a half hour each way driving out just to give them their pills. We don't have enough nurses. We don't have enough home health nurses. We don't have enough caregivers. 80% of the long-term care in this country is not being provided by a nurse or an assisted living community or a nursing home or a home health agency. It's being provided by 43.5 million family members. And they're exhausted, they're stressed out. I call it the three-legged stool of caregiving, but I mean basically it's collapsing. The first leg time is already collapsed. We have dual working spouses now. So neither one of them are home during the week. They go over to mom's house on a Saturday. What do? The wife goes inside. She makes a little Ziploc freezer bag meals, right? She fills up the pill box. The husband goes outside and mows the lawn. He goes inside, pays mom's bills. They take mom out to Applebee's for dinner. They take her home because on Sunday they take care of their house because on Monday they're back to work. I mean, this leg is already collapsed. These families are exhausted. Studies have shown that. They're physically exhausted. They're emotionally exhausted. They're financially exhausted. It's costing us billions of dollars in productivity each year. Second leg is proximity. We all grew up and moved away. Well, it's not that we don't love our moms and dads any more than previous generations. We're 1,000 miles away. 20% of baby boomers live an hour or more away from their parents. And that could be 1,000 miles. And that's numbers going up every year. And then the third leg is what I call energy. Look, in 1900, there were 3,500 people over the age of 100 in this country. By 2050, there will be 850,000 centenarians in this country. Think about that. Now think about this. If your mom's 100, how old are you? Right? Who's doing the two-person lift? So we've got big issues here because 15% of these family caregivers are over the age of 65. And that's not spouses taking care of spouses. That's 70 and 75-year-old sons and daughters trying to take care of 90 and 95-year-old moms and dads. So if you look at time, it's already collapsed, proximity collapsing, energy about to collapse, 80% of the providers of long-term care in this country are about to have the system collapse on them. And we've got to think about ways that we can help them, and that will be technology. And then quickly, even in the healthcare system, I run 130 assisted living communities all across the country. So what you probably think is, well, gosh, Andy, that's good for your business. Not if I don't have enough people to help them. We've got 2 million long-term care workers today. We need to triple that number to 6 million by 2030. Well, in 2030, when the last of the baby boomers retires, Bureau of Labor Statistics says there'll be 35 million more jobs than people to fill them. I'm mathematically eliminated from having enough people to help them. So we've got to find technologies to help these family caregivers so mom or dad can stay home, quite frankly, by themselves. And I've got to have technologies in 130 assisted living communities that will make one nurse's aide in the future as productive as 3 today, which is how I get the equivalent of 6 million workers out of 2 million people. This is really important stuff.
Right. Well, thank you. Yushim, let's turn to telemedicine. You started talking about iPhones and cell phones. A little bit different though. Is telemedicine really improving outcomes? And if it is or is not, how are you tracking?
Mm-hmm. The results shows that telemedicine can improve outcomes. A lot of many systematic results shows that. But when you think about those outcomes, we can think about different outcomes. Like from the patient level, they will be more satisfied with care, and also when they maintain their hemoglobin levels or blood pressure or lipid levels, they feel better, right? And also I think that's kind of the outcomes. And then from the provider's perspective, they can reduce the time to manage patients in the acute or in the long-term care. And from the organizational perspective, I think what about the hospital readmission? So those hospital readmission, ER admissions can be reduced using those technologies. I think one good example as you give, think about the primary care providers who takes care of their patients in the rural areas. So they would like to give really good care, but they might short of specialist care, right? In that case, using telemedicine devices, they can provide the best care even though they are in the remote areas. And eventually, I think that those technologies can reduce the cost. And also, I think that's going to be more important when we go with more population health. And I think under the Affordable Care Act, I think we try to keep our patients outside. I think from that perspective, I think our care providers and administrators in the long-term and post-acute care areas, I think their role will be really important. And also, I think they have to think about those innovative ways to provide better care with a reduced cost. I think that's kind of outcome.
I just have a follow-up to that. Can you give us some idea of the uptake of telemedicine?
Mm-hmm.
Is it widely used? Are there some holdouts who refuse to use it, whether it's providers or patients?
Yeah.
And what are the barriers to that? Why are people not using it?
So I think that it has been uptake. The adoption rate has been increased based on the policy. Nowadays, the amazing thing is that the majority of states reimburse telemedicine. I think that was very surprising to me. A few years ago, only few states reimbursed the telemedicine cost. But nowadays, when you Google search, you can see the majority of states do reimburse certain level of telemedicine consultations or treatment. And as you can see, like Healthy People 2020 highly emphasized the importance of e-health and health technologies. So there is a growing need, but in terms of the providers, I think adoption, I think we made really great changes. They are adopting the technologies. For example, there's a company, EICU. So what EICU does is that they provide intensive specialist care remotely to the hospitals. And there are many hospitals actually use that EICU system or the service because they want to reduce the cost for emergency cases. But in terms of the patients, I would say that because of the technology changes, I think patients are getting used to it. But from the older adults' perspective, I do like to say that technology is for not everybody. Sometimes older adults may feel comfortable when they see the doctors. Then for them, the technology that works is to seeing patients. But some patients may want to use services. So I would say that older adults, I think there is a growing adaptation, but at the same time, I would like to say that we need to identify their needs, what is their comfort level, and provide the optimal care their needs.
Right, thank you. Andy, what are some of the opportunities to consider in digital technology for older adults and for organizations?
Well, I mean, to follow Dr. Nam, I think some of them we're seeing now. You know, that radiologist in India who's reading your CAT scan at 3 a.m. because it's the middle of the day there, and now you don't have to wait for the results. That's affecting you now. Anybody here wearing a Fitbit? That's telemedicine. I mean, why do you wear it? To be healthy. Also, it's kind of cool. So we're seeing some of it now. What we need to do is integrate it more into our lives and look at kind of the big buckets we deal with in healthcare. I mean, you talk about disease prevention and policy issues, right? I mean, the number one cause of hospitalizations of seniors in this country, number one cause is medication errors. Medication errors. By the way, they're using Medicare to pay for that hospitalization, which means you're all paying for it. And it's billions of dollars. 125,000 people a year in this country die from medication errors, which would be the equivalent of a 747 crashing and everybody on board dying every single day of the year in this country. And nobody's talking about it. All right? I mean, it's a big issue. It's a big issue. And, you know, typical 70-year-olds on anywhere from 7 to 12 medications. I can't keep track of 7 to 12 medications. I barely found my way here this morning. So, you know, we need to do things like automated robotic medication dispensers, which we now have, that are not just pill boxes, they're cellular pill boxes. So you can program them. So you know that at 9 o'clock in the morning on Wednesday, if your mom didn't take that pill out of that little square, that little compartment, that compartment starts flashing at 9 a.m. and at 9:30 it starts beeping, and at 10 o'clock it calls you on the phone. Or it sends you a text message letting you know that your mom didn't pick up that pill for some reason. It even can track her over the course of a week or a month to know if she's just being late. Maybe she's on a new medication that's, you know, affecting her. Now we can adjust those medications. We're doing all of that over cellular networks. You're managing that from 1,000 miles away. We've got e-pills now that the FDA just approved last year, end of 2014. So now not only do we know she took it out of the box, we know she swallowed it because it's in her bloodstream. And we also know how it affected her heart rate and her activity levels. You don't even need a Fitbit. Just take a pill. You can swallow a Fitbit. But we can track lots of things with that now. And, you know, it's a big difference between an 85-pound, 85-year-old woman and an 85-year-old, 160-pound man. But a lot of times those doctors give them the same prescription. So now, when it's in their bloodstream, now not only are we addressing medication errors and keeping them out of the hospital and keeping them alive, now we're really giving them the right doses and really saving not only them, but the healthcare system's billions of dollars. So these are important kinds of things that we can see in opportunities. And then, you know, keeping them from falling, keeping them from getting lost. And all of this is done over the airwaves. All of it's done over the airwaves.
Well, you mentioned Fitbit, and I'm going to take this opportunity to ask you about your GPS shoes.
Sure.
Another use of telemedicine. So I
Well,
don't know
I mean,
if people are aware of this.
and thanks, but I mean, look, it's a big issue. We were talking about Alzheimer's earlier, but about, you know, half of everybody over the age of 85 is affected in some way. I just told you we're going to live to be 100, so you can do the math. It's a problem. 60% of those people will wander and become lost at least once. And one study showed that if they're not found within 24 hours, almost half of them are dead from dehydration, from exposure, from injury. It's a big, big problem. It's a problem for them. It's a real problem for the caregivers. We've got 15 million caregivers in this country trying to take care of 5 million people with Alzheimer's. By the way, short of a cure, that number is going to quadruple by 2050, and we don't have a cure imminent. And these caregivers are exhausted and very high rates of depression, very high rates of physical exhaustion. They don't go to the bathroom by themselves. They have to take someone with them because they're afraid if they don't, they'll be gone when they come out the door. So what can we do? Well, we can put GPS in an insole and miniaturize it and put it in their shoe so that in the early stages, we've hidden it. In the early stages, it's a dignity issue because they're not on parole. They shouldn't have to wear something on their wrist. But in the later stages, when we know confusion, paranoia are the primary manifestations, and we know they take things off, you know, locking something on someone's wrist that's a tracker who has paranoia is cruel. It's wrong. And by the way, they'll break their wrist to get it off. So what did we do? We hid it in their shoe. Why their shoe? Because procedural memory is the last type of memory they retain, which is also known as habitual memory, which includes, guess what, getting dressed or staying dressed if someone helps you. It's very rare, actually, to find somebody with Alzheimer's who's wandered who doesn't have their shoes on, let alone their clothes on. It's actually quite rare. So what we've done is we've maximized the odds by hiding it on them. We've maximized the odds that it will be on them when we need it. What does this mean? It means we can set up a geofence online around their house. I was showing these guys this morning. I left my house and my cell phone went off at the end of my street with a Google link telling me I had left my geozone. 30 seconds later, I got a text from my wife saying, "Who told you could leave the house?" But the point is I have a geofence around my house, and when I go about 200 yards, it does tell me I left. Think about the caregivers. Think about what that means. Now they can go to the bathroom. And if dad does leave the house and go the wrong way, or think about the people in the early stages where walking is one of the best things they can do to delay the onset of the symptoms. They can go for a walk every day. You just want to know the day they make the wrong turn. And now what are we doing? Now we're getting a Google link, a text message, an email, and we're finding them in 2 minutes. Not 20 minutes, not 2 hours, not 2 days, 2 minutes. And I know I told Carter briefly this morning we're doing a pilot with NYPD because they found out they're spending between $800,000 and $1 million a month in New York City just on search and rescues. They're supposed to be fighting crime. And they have to stop everything they're doing to go look for somebody. So everybody's losing here. The senior who has Alzheimer's is at risk. The caregivers are exhausted. The public is paying for this billions and billions of dollars. They end up in the hospital a lot of times. And we can fix all of that by miniaturizing GPS and putting it in their shoes. So that's the power of technology. And these, by the way, are all over the world. GPS is all over the world. These are in 30 countries now. And I've seen the map lit up all over the world. It's kind of cool. People who are wearing these, and the emails we're receiving from family members saying, look, this is making a big difference. It's that simple. It's that simple, and we can do this.
Great, great. So I think I'm going to buy some for my husband. So I'll talk to you afterwards.
Okay.
So Yushim, how will trends in information communication technology and adaptive technologies impact the industry?
Yeah. Well, again, I think this morning, kind of audience already talked about it. But in terms of the trend, I heard a lot about the Wi-Fi, e-health, and the EHR, those aspects. So I think that we can think about the two different types of industries. First is long-term care or post-acute facilities. And then the other is industry that develops technology. So from the facility perspective, I do think that in the future, the technology will be a norm. The residents or patients will expect that the facility will be wired. They can have the internet and they will have EHR and so forth. So technology will be a norm. And then the other aspect is that our caregivers and patients will be more engaged, empowered. Because as you know that nowadays all those up-to-date medical, the research information is available online. Everybody can access to it. So our caregivers, especially caregivers, and our older adults can study or do their homework about their disease or treatment options. So they will be more prepared, and sometimes they do have information overload, right? So it is important that we guide them through the right information, but I think at the end of the day, we will have more empowered, engaged patients, and they would like to be in the driver's seat in terms of the care. I think that's the right thing to do, and we know that our patients are kind of our team members, and they should be motivated to make themselves better. So I think we will see more of those. And from the other perspectives, that from our administrator's perspective, if you ought to provide all those technologies, it costs money, isn't it? So how do we get the money and how we maintain the facilities? So there are a lot of policy issues that we have to think about, and I think that a lot of work is being done. And from the developer's perspective, nowadays I see a lot of more companies are working for the technologies that can be used in the long-term care setting, especially in the EHR business. Before several years ago, I think those major vendors focused on the development of acute hospital information systems. But nowadays they are more focusing on long-term care information systems and systems that can be used home care or post-acute care areas. So that's going to be, I think, the impact in the industry. And at the same time, I think that because users are become more sophisticated, and our developers need to find a way that they need to understand that they need to work with the users, and not just for work for the users, but include them and into the development team and work with the, just design a technology with them, not just for them. I think that's going to be important impact.
So you mentioned the caregiver. So do you think that the product producers or providers are actually meeting the needs of caregivers now, or are they on the right track?
Yeah, I do think that they're on the right track. A lot of work needs to be done, but a good example is like patient portal. Like patient portal is for patients, right? But at the same time, we give proxies so that caregivers can use them. And this is a good example. Caregivers can use the technology and make it better. Or the robotic technologies, robots can do only limited amount of work, but at the same time, they can help caregivers. So I think we are on the right track, but a lot of work needs to be done. And that work cannot be done by one entity. It has to be done with patients, caregivers, and then developers, and also the providers. I think that's very important aspect.
And Andy, I'm really curious about your nanotechnology. I think when I first read that, I thought, oh, he's the inventor of nanotechnology. Then I read it again. I thought, no, nanotechnology.
I wish nanotechnology.
I know, that's
really I wouldn't even be sitting here.
I know, that's what I was thinking too. I've got to meet this guy.
Not that I don't like.
So do you see, I think we're talking a lot about technology, and obviously it's going to grow in the future.
Yeah.
So what are some specific ways you've seen nanotechnology benefiting, let's say, the healthy aging process?
Well, I think it's what we've been talking. We need to integrate it into their lives. And I call it the great divide between geeks and grams. The problem is most of the people inventing the technologies are 20 years old. They have no idea what it's like to be 85 years old. And I think that's the role that we all play, is to kind of be that UN interpreter. I remember a young man from Carnegie Mellon a number of years ago at some exhibition. He was very excited to tell me about this floor he invented that had all these wires in it, and it could tell you if grandma fell down if she was on the floor. And I looked at him and said, that's great, can the floor pick her up? And it hadn't occurred to him that if she's fallen and she's hurt, somebody needs to be there. So I think we have to make these connections. We have to think about how we integrate it into their life. It's actually a myth that seniors don't like technology. Actually, they're way ahead of us. What they don't like is reading a 60-page manual. A senior told me that one time. She said, my user's manual for my cell phone is bigger than my phone. See, that's the problem. They're ahead of us. When they grew up and technology was invented, you got a dishwasher, you plugged it in, it worked, right? You got a vacuum cleaner, you plugged it in, it worked. Those were inventions in their days. But now what we have is a 60-page user manual. So they're waiting for us to catch up with them. And this is why things like, you just put this in your shoe, you don't have to do anything. We have to make it seamless in their lives. We're talking about now iTextiles. Some of you have Fitbits. But in the next 10 years or so, you won't even need your Fitbit. It'll be in your T-shirt. It'll be in your underwear. And your underwear will track you. All you got to do is wash it dry and put it on. And your underwear will monitor your blood rate, your respiration, your heart rate, your perspiration. They're looking at applications for diabetics to measure your blood sugar, for people with high cholesterol to measure your cholesterol levels. This shirt, if you have a heart attack and fall down on the sidewalk, will know that you've had a heart attack, and your shirt will dial 911 and use GPS to send the ambulance crew to come get you. All you did was get dressed in the morning. By the way, MIT is working on, talk about nanotechnology. MIT is using molecular engineering, and they think within about 5 to 7 years, they will have a T-shirt that if you've had a heart attack and you're down on the ground, the T-shirt will contract and release and contract and release, and the T-shirt will administer CPR while it's calling 911 to tell them that you're on the ground and where you are. And all you did was get dressed. All you did was get dressed. Remember your mom used to say, wear your good underwear? Yeah. Well, your good underwear will save your good underwear will give you CPR. This is what we're talking. This isn't 50 years. We're talking 5, 6, 7, maybe 10 years. So all of these things have to be seamless, and then we will catch up with the seniors who, frankly, have been waiting for it to be that seamless. That's all they've been waiting for.
That's great. That's a good spin on it.
Yeah, I think it came out well.
I know, it did. So anyway, you see the chairs have appeared. So that means the fishbowl is open for feeding, should I say? So if you have a question, the only way it will be asked is if you come sit next to me or you sit next to Andy. So we'll go on with the questions, but come on up. Don't be shy. So, Shim, what challenges does technology present to society and organizations? So we've talked about the good things, but what are the challenges?
A lot of them.
Yeah.
Okay. Well, I think that we can think about many things, but the first thing comes to my mind is the cost, funding, and the policy level. Just because to provide technologies, to develop and to implement technology, it costs money, and where is that from? And from that regard, I think that I wish that we can see more that the infrastructure money can go to post-acute and assisted living area. Like I'm sure that many of you feel it, but you heard about the meaningful use, right? Meaningful use incentive, but to get the incentives, only the eligible providers are acute hospitals, not the long-term care providers. But at the same time, we know that long-term care providers are using EHRs. I mean, they have been doing the MDS for a long time. They are using the system. So I do think that that's a challenge. Money and then the policy, how we can change the policy so that the older adults can benefit from. And then the other challenge would be that technology development, the usability. I heard a lot about the usability. Technology needs to fit the users, and technology is not for everyone. Then how the developers listen to our older adults and work with them to make technology better. I think the usability is an important issue, and invisible technology. The technology should be invisible. To be effective, you shouldn't notice the technology. It's so well integrated with the environment and with human life. It shouldn't be visible, but it's hard, lofty task to achieve. But I think that's the technology. I mean, that's the challenge. And the other issue is the digital divide. I think in the morning we talked about certain organizations can afford really good technologies, and many older adults can afford tablets or iPhone, iPads, but at the same time, we know that there are older adults who do not have any benefit from the technology just because they do not have access or they do not know how to use it. So it is our task to reduce the gap, and I think even without funding, we can do a lot. I think by just teaching them how to use it, showing them the benefits of technology, I think we can kind of reduce the gap a little bit. So I think those kind of three things I can think about.
Okay. And then, Andy, in terms of the vast array of technologies that could be possible, would we see a day when there could be one technology that would fit everyone? Is it one size fits all, or do we need to constantly innovate to come up with a custom?
Well, what's happened is we can invent technology that can do almost anything. So we're working on robotics. We've invented robots that can do almost any task. There's a robot in Japan called AR, Assistive Robot, that can literally load and unload your dishwasher, sweep your kitchen floor, and do your laundry. The problem is the missing link that I think is universal is the ability for a true voice communication. And anybody who's tried to do talk to text or use Siri knows it has limitations. So I think what's the missing link right now is the ability to truly talk to things, to your devices. And when we hit that, then I think the whole world changes overnight. Because we have built robots, some that are obvious, some that are, pill boxes. They can do almost any task you want, but we can't really talk to them. So think about in 10 years when we have that, and I think it's probably no more than 10 years away. They're working really hard on true voice recognition. So now you will have to go to the Smithsonian to show your kids a remote control, because you will just talk to your TV. You will talk to your ceiling fan. You will talk to your thermostat. I have a talking thermostat, but it never understands what I'm saying. So I'm about ready to rip it off the wall. But if I had one that did understand what I was saying, I could just use my Italian voice to shout across the room, I'm cold, and it would fix it. So things that we have to talk to them, and then accelerate that all the way up. You're talking to your refrigerator. You're talking to your washer and dryer. You're talking to your house, let alone your personal assistive robot. And we talk now about self-driving cars. What if you were also talking to that car? Remember when you were a kid, all the TV shows had talking cars? Well, we'll have talking cars. So right now, everybody's talking about self-driving cars, and I'm going, that's done. We need to talk to our car. We need to be able to get in our car and just literally say, take me to Walmart, and off we go. And it knows which Walmart you like. So I think when we cross that threshold, in probably less than 10 years, watch what happens on this planet. Because not just seniors, everything in your world will change. Everything in your world will change.
Right. Well, someone's joined the Fishbowl.
Hello.
So would you like to introduce yourself?
Sure.
And ask your question.
Sure, my name is Felicia Chu. And my question has to do with access to all this wonderful technology. And as industry leaders here, what can we do to move access forward so that it's covered by insurance or recognized and available? Because what you're mentioning is high ticket, and the seniors that probably need it most don't have access. So what can we do to move that that movement along?
Well, briefly, I teach at Mason, but I am the COO of 130 assisted living communities. So, I mean, this is an issue for me. It's about cost. And I'd love to put all this stuff in my buildings. I'd love to have a robot that does all the lifting so my nurses don't hurt their backs. Number one reason we lose a nurse is back injuries. They're working on that in Japan, but I mean, it's $1 million. Well, you know what? Get it down to 100,000. I'll put it in 130 buildings. That's paid for. So I think it's about scalability. What we need to do is keep driving it. Things get cheaper really fast with technology. We know that. We know that. I mean, those things are $299. I mean, come on. That's less than $1 a day for somebody caring for somebody with Alzheimer's. But we've got to be able to scale them and keep bringing that cost down to a price point that not just families, but even big operators like my company can afford. And we will use it in 2 seconds, but we do have to be able to figure out how to pay for it.
And do you see Medicare insurance ever picking up costs?
Well, then you have to show them the value proposition. So this is where researchers like Dr. Nam come in, because I know that works, but I'm not a PhD. We need somebody to show that NYPD can save $1 million a month. And then, I mean, of course you would buy those. Of course you would put those in everybody. But we need to work together on it. We need researchers to come together and say, well, that's cool. And I say to you, well, take it. Go study it. Show the numbers. Show how we're saving lives. Show how we're keeping people out of hospitals. Show how by getting their pills right, we're not wasting billions of dollars in hospital bills. But we need to work together on that. And so I have a skill set. Dr. Nam has a skill set. We need to come together and say, how do we make this work?
And also, I would like to add that it is very important that the leaders voice their opinions and then be involved in policy level. If there is any working groups or advisory board groups, and there is always the national calls out there. They're looking for participants. Then I think that our leaders need to be involved and they should be at the table and address your needs, because otherwise, if they don't hear you, it's not going to happen. But through the meaningful use, I really see the importance of the government and policy, because for several years, the adoption of EHR was just skyrocketed, like 25% around that age, the level, and right now I think it's over 80%. Sorry, I cannot recall exact numbers, but the change that government was able to make was amazing. And of course, it's the strategy was carrot and sticks, because incentive and penalty, right? So I think that our leaders' role is very important to change the policies.
And then, Andy, what you said about if you want to go. If you want to go, you're
And
allowed
she
to.
flees.
Does someone else come up?
I know where you are.
But building on something that you said, Andy, and the importance of having that data, the evaluation data, everything has to be evidence-based. And for the federal government to reimburse, you need the evidence. So when you're working with clients, for example, the New York Police Department, do you pull in a researcher and say, we need to capture all your data? Because that's the type of data that we need to collect.
It's exactly what we ran into.
Yeah.
I went to the NYPD. I was talking to one of the police captains in Brooklyn. And I said, so how many search and rescues do you do a month? And he said, I don't know. Don't you track this? You know, we never really track it. We do a lot, though. And so we sent a grad student up. And for one, they went through all the records and tracked for basically 28 days. It was all there, but it was literally on pieces of paper shoved in file cabinet drawers in the Bronx. And that's when we discovered that they had done 80 search and rescues in one 28-day period. And then we did the math to figure out that that was about $10,000 a person. And if you did that over a 31-day month, you're talking $800,000 to $1 million a month. And then the police captain looked at me and said, oh, you're kidding me. So there's a lot of work that needs to be done on it. And then, you know, yeah, people will pay for things, but we need, by the way, as a grad student, I mean, come on, you can do better. There you go. But I mean, in that little thing, we had some evidence. Now what we need to do is, of course, is really systematize it and take it to the next level. Those robotic medication boxes, I mean, they're $40 a month. Come on, common sense tells you that they're saving Medicare lots of money. But no one has tracked them. Nobody has said, for less than $500 a year, we can keep someone from making a medication mistake and going to the hospital, let alone dying. And we just need to do the studies.
Mm-hmm. No, that's an excellent point. We run into that all the time with policy issues. And Yushin, you had, I'm going to stop because we have another fish. Wait, please introduce yourself before you ask your question.
I'm Stacey Judge from Spring Point Senior Living. I am glad that you mentioned voice recognition technology because before I came to this forum, I sat down last week with a couple of residents in my communities, one of whom is an 80-year-old woman who really runs the computer group, teaches a lot of computer technology to her 85-year-old plus peers. And I asked her, I said, really, you know, what are your concerns? What do you think that the needs are for technology to bridging that gap for our services? Because again, we can have wonderful, lofty ideas, but if we don't talk to our end users, and she actually brought up the verbal recognition and that technology. But she said, you know, here's the thing where one of the questions before was, are humans adapting to technology or is technology adapting to us? The technology is going to have to be very quickly adapting to the user because one of the things she said is, how is that your voice can be affected by medications you take, the aging process itself, you know, chronic disease. So how could it be a choice maybe between verbal recognition, touch screen, for people who, let's say, are aphasic, or you know, how do you see that that coming out, and is it really that easy to get there? I mean,
Well, most of it's easy. First of all, see, she's right on it. That's what we thought. You spent all day with them, so do I. They're right on it. They just don't want a 60-page user manual.
That's right,
I mean,
absolutely.
Only we will read that. So I think we've done most of it. We have the touch stuff. We really have everything but the voice, I think. I did work with Apple on the iPad when it first came out, and they didn't think it would work with seniors. And with you and I mean, I knew. It turns out the reason seniors don't use computers.
They don't.
I just hate technology. But we're having fun. But one of the things with Apple, they said, why do you think the iPad will work with seniors? I said, seniors don't have a problem with computers, and you'll get this. I said, they don't like the mouse and the keyboard.
That's exactly what she
said. If
said.
you get rid of the mouse and the keyboard, they don't have a problem with the computer. And so we took it to an assisted living community, and I mean, within 3-4 minutes, they had actually found my gambling app and had lost $3,000. But I mean, even Apple didn't realize, because they don't deal in that world, that's all that was missing. So I think we can do the touch stuff. We can do a lot of the things, but the again, I think the voice recognition. You know, a lot of people who fall and break things. You know why they do it? They use a walker. It's not the walker that's the problem. It's that they put it over there and tried to get to this chair, and then they got up and tried to get back. Well, what if we had a voice-controlled walker, and you say park, and then you have it come back? And they're working on that. Now my walker comes back to me and I can get up and I can go where I'm going. By the way, it has obstacle avoidance, so it's basically a self-driving walker. It gets me around things. These are the things that we can do if we can talk to it. So to answer your question, I think we have everything but that, honestly.
And do you think there'll be some adaptations for people, you know, as their voice changes? Will
True voice recognition should be able to hear your voice and understand it as well as you and I talking. So when I say true voice recognition, that's the definition. And anybody who's tried to use Siri knows we're not there yet.
Amen.
That's right. So we've actually hit time, but we have a new fish.
Thank you.
So I think we can do one more question. But introduce yourself.
Oh, Lori Snow. I'm with It's Never Too Late, and we build adaptive computer systems, engagement systems. But my question isn't about that. I want to ask you about 8 years ago, I started working in the long-term care industry, and I came across a company called WellAware. They don't exist anymore. You familiar?
Yep.
They had bed sensors.
Yep.
They were pennies a day, and they detected
Yes.
medication interactions and seamless. And as you were talking about, if things get less expensive,
Right.
and it can prevent these large readmissions, these large costs, people would adopt them, but they don't.
Right.
So I'm wondering, it's not just a matter of cost and good outcomes. There's another bugaboo that's preventing long-term care from really running with technology, I think. And I don't know what it is.
Well, it's the early adapter scenario. You know, there were the people who lined up to buy the first iPhone and slept on the sidewalk for 2 days. And then there were people like me who said, let me know when iPhone 5 comes out. So I think a lot of people are just pragmatic. You kind of got to be a geek, frankly, to want to get the first of anything, because it's going to have bugaboos. And so we do need those early adapters who are the heroes, frankly,
Right.
who will spend the money to try out the first things, and then the rest of us sit back calmly and wait. But that's just kind of human nature, I think, to some extent. But we need to keep driving it. What you need to do is seek out those geeks
The early adopters.
who will do it just because it's cool, and then you have fun with it.
Great. Okay. Well, thank you. Thank you to the fish who joined us, and the rest of you who, I guess, were at peace with their silence. Is that it? And many thanks to you, Shim and Andy, for providing your insights on what those opportunities and challenges we face. And actually, we learned a lot, just what technology is and how we can use it, what we can look forward to.